Concept map care plans are very important tools for nursing students. They help you learn how to think like a nurse. These plans are not just assignments. They are a way to practice critical thinking. You will use these skills every day in your nursing career. Concept maps help you see the whole picture of your patient. They connect different pieces of information about the patient's health. This visual way of organizing information makes complex patient situations easier to understand. It allows you to link symptoms, medical history, medications, and nursing interventions in a clear and logical manner, fostering a deeper comprehension of patient care needs. Using concept maps helps you organize patient data effectively. You learn to gather information from different sources. These sources include the patient's chart, your assessment, and what the patient tells you. Then, you put all this information together in a visual map. This map shows how different problems are related. For example, it can show how a patient's breathing problem affects their ability to eat or sleep. This holistic approach ensures that no aspect of the patient's condition is overlooked. It encourages a methodical way of thinking that moves beyond simply listing problems to understanding their interconnectedness and impact on the patient's overall well-being and recovery process. Concept maps also improve your problem-solving skills. As a nursing student, you need to identify patient problems. You also need to decide what to do about these problems. Concept maps guide you through this process. They help you prioritize which problem is most important to address first. This is a crucial skill in nursing, where situations can change quickly. Learning to prioritize effectively means you can provide safer and more effective care. The visual nature of the map allows you to see potential complications and plan preventative actions, thereby enhancing patient safety and promoting better health outcomes through proactive care strategies. Finally, concept map care plans prepare you for real-world nursing. In hospitals and clinics, nurses use care plans every day. These plans guide the care that patients receive. By mastering concept maps in school, you will be ready for this important part of your job. You will feel more confident in your ability to plan and provide excellent patient care. This early exposure and practice build a strong foundation for clinical judgment. It translates directly into more organized, thoughtful, and patient-centered care when you begin your professional nursing practice, making you a more competent and reliable healthcare provider from the very start of your career. Understanding pathophysiology is key to creating good nursing care plans. Pathophysiology is the study of how diseases affect the body. It explains what goes wrong in the body when someone is sick. For example, if a patient has pneumonia, pathophysiology helps us understand how the infection affects their lungs. It tells us why they might have a cough, fever, or trouble breathing. This knowledge allows nurses to anticipate patient needs and potential complications. Knowing the underlying mechanisms of a disease helps in selecting appropriate interventions and evaluating their effectiveness, forming the scientific basis for nursing actions. When you understand the pathophysiology, you can better identify patient problems. You can see how a disease process is causing the patient's symptoms. Let's consider our patient, Mrs. Carter, with pneumonia. The infection causes inflammation and fluid in her lungs. This makes it hard for oxygen to get into her blood. This understanding helps you realize why she is short of breath and tired. It also helps you understand why her oxygen saturation might be low. This direct link between the disease process and its manifestations is crucial for accurate nursing diagnosis and planning care tailored to the specific physiological disruptions experienced by the patient. This knowledge also helps you choose the right nursing interventions. If you know that fluid in the lungs is the problem in pneumonia, you will understand why certain actions help. For example, encouraging coughing and deep breathing helps clear that fluid. Positioning the patient with the head of the bed elevated makes breathing easier. Giving oxygen as prescribed helps get more oxygen into the blood. These interventions directly address the pathophysiological changes. Understanding the science behind these actions reinforces their importance and helps you explain them to the patient, promoting adherence and collaboration in their care. Furthermore, understanding pathophysiology helps you educate your patients. Patients often want to know what is happening to them. If you understand their disease, you can explain it in simple terms. For Mrs. Carter, you could explain how the infection in her lungs is making her feel unwell. You can also explain how the treatments and nursing care will help her body fight the infection and heal. This empowers patients to participate in their own care. When patients understand their condition, they are more likely to follow the treatment plan, leading to better health outcomes and increased patient satisfaction with the care they receive. SBAR is a very useful tool for communication in healthcare. SBAR stands for Situation, Background, Assessment, and Recommendation. It provides a clear and structured way for nurses to share important patient information. This is especially important during shift changes or when calling a doctor about a patient. Using SBAR helps ensure that no important details are missed. It makes communication more efficient and reduces the chance of errors. This standardized approach promotes patient safety by ensuring that all team members have a shared understanding of the patient's current status and the plan of care moving forward. The S in SBAR stands for Situation. This is where you briefly state the problem. You should identify yourself, your unit, the patient's name, and briefly what is going on with the patient. For example, for Mrs. Carter, you might say, "This is nurse your name from the medical unit. I am calling about Mrs. Emily Carter. She is experiencing increased shortness of breath and her oxygen saturation has dropped to 88% on 2 liters of oxygen." This immediate, concise overview alerts the receiver to the urgency and core issue, setting the stage for the information that follows and allowing for quick prioritization of the situation. The B stands for Background. Here you provide relevant information about the patient's history. This includes the admitting diagnosis, date of admission, and any important medical history. For Mrs. Carter, you would mention her diagnosis of community-acquired pneumonia. You would also state her history of COPD and type 2 diabetes. You might add that she was admitted 2 days ago and has been on antibiotics. This context helps the person you are speaking to understand the patient's overall condition. It provides essential details that might influence the current situation or the recommended course of action, ensuring informed decision-making. The A is for Assessment. This is where you share your findings. You should include recent vital signs, lab results, and your clinical observations. For Mrs. Carter, you would report her current respiratory rate, heart rate, blood pressure, and temperature. You would mention her oxygen saturation of 88% and that you hear crackles in her lung bases. You might also note her increased work of breathing and complaints of feeling more tired. This objective and subjective data provides a clear picture of the patient's current clinical status. It offers concrete evidence to support your concerns and the reason for the communication, demonstrating a thorough evaluation. Finally, the R stands for Recommendation. This is what you think needs to be done for the patient. You might suggest a specific action or ask for an order. For Mrs. Carter, you might recommend, "I think Mrs. Carter may need an increase in her oxygen therapy. Would you like me to try a non-rebreather mask? Or perhaps we should get a chest x-ray to see if her pneumonia is worsening." This shows you have thought about the situation and have a plan. It facilitates a collaborative approach to patient care and prompts timely interventions to address the patient's changing needs, ultimately contributing to better patient outcomes. Section 5. Looking ahead, incorporating at risk for diagnoses. Besides actual diagnoses, at risk for diagnoses are also very important. These diagnoses identify problems that the patient does not have yet, but is likely to develop if you do not intervene. They are about preventing future problems. For at risk for diagnoses, you do not list as evidenced by, because the problem has not occurred. Instead, you list the risk factors that make the patient vulnerable. These diagnoses highlight the proactive and preventative aspects of nursing care, which are essential for patient safety and promoting optimal health outcomes by anticipating potential complications before they arise. Identifying risk factors requires careful assessment and critical thinking. You need to look at the patient's current health status, medical history, treatments, and environment. For Mrs. Carter, her pneumonia, COPD, diabetes, and current immobility due to fatigue place her at risk for several issues. For instance, her diabetes can impair wound healing and immune response, while her immobility can lead to skin breakdown or blood clots. Considering these factors helps you to anticipate potential negative outcomes. This foresight allows you to implement preventative measures early, thereby minimizing the chances of these complications developing and impacting her recovery. A significant at-risk for diagnosis for Mrs. Carter would be risk for ineffective peripheral tissue perfusion related to compromised oxygen transport secondary to impaired gas exchange and history of type 2 diabetes. Diabetes often affects circulation, and her current respiratory issues could worsen tissue oxygenation. There are no current signs of this, but the risk is present. By identifying this risk, nurses can implement interventions like regular skin assessments, encouraging gentle movement, and monitoring for any changes in skin color or temperature in her extremities, thus protecting her from potential circulatory complications. Another important at-risk for diagnosis for Mrs. Carter is risk for infection, spread or new, related to compromised immune system secondary to existing pneumonia, COPD, and type 2 diabetes. While she already has pneumonia, she is at risk for it worsening or developing a new infection because her body is already fighting one illness and her chronic conditions weaken her defenses. Recognizing this risk prompts nurses to emphasize strict hand hygiene, monitor for new signs of infection like a worsening fever or changes in sputum, and ensure aseptic technique during procedures. This vigilance is crucial in protecting vulnerable patients like Mrs. Carter from further health setbacks. Section 6. Taking action. Key nursing interventions for your diagnoses. Once you have your nursing diagnoses, the next step is to plan your nursing interventions. These are the actions that nurses take to help the patient achieve their desired outcomes. For each nursing diagnosis, you should list specific interventions. These interventions should be evidence-based, meaning they are supported by research and best practices. They should directly address the related part of your diagnosis. For Mrs. Carter, we have 5 diagnoses, and we will outline 5 interventions for each, focusing on practical, actionable steps that the nursing team can implement to improve her condition and prevent complications. For ineffective airway clearance. 1. Assess respiratory rate, depth and effort, and auscultate lung sounds every 2 to 4 hours to monitor changes. 2. Encourage deep breathing and coughing exercises every 1 to 2 hours while awake. Teach splinting technique. 3. Position patient in semi-Fowler's or high Fowler's position to promote lung expansion and ease of breathing. 4. Administer prescribed mucolytic agents or bronchodilators and monitor their effectiveness. 5. Ensure adequate hydration, for example, encourage fluid intake of 2 to 3 liters per day, if not contraindicated, to help thin secretions. These interventions aim to help Mrs. Carter clear mucus from her lungs more effectively, improving her breathing. For impaired gas exchange, 1. Monitor oxygen saturation continuously or every 1 to 2 hours. Report levels below 90% or as per protocol. 2. Administer supplemental oxygen as prescribed, titrating to maintain target saturation levels. 3. Assess level of consciousness and monitor for signs of restlessness or confusion, which can indicate hypoxia. 4. Minimize oxygen demand by assisting with activities of daily living and scheduling rest periods. 5. Collaborate with respiratory therapy for advanced airway management or ventilation support if needed. These actions focus on ensuring Mrs. Carter receives enough oxygen and that her body is using it effectively. For activity and tolerance. 1. Assess patient's response to activity, monitoring vital signs like heart rate, respiratory rate, and blood pressure before, during, and after. 2. Gradually increase activity levels as tolerated, starting with passive range of motion exercises if bedbound. 3. Provide assistance with activities of daily living as needed, allowing the patient to do as much as possible for herself. 4. Teach energy conservation techniques, such as sitting while performing tasks and pacing activities. 5. Ensure the patient has adequate rest periods between activities to prevent overexertion. These interventions help Mrs. Carter slowly build her strength and endurance without becoming overly tired. For risk for ineffective peripheral tissue, perfusion. 1. Assess peripheral pulses, skin color, temperature, and capillary refill in extremities every 4 hours. 2. Encourage frequent position changes at least every 2 hours, if on bed rest, to promote circulation. 3. Instruct patient on the importance of avoiding crossing legs and wearing restrictive clothing. 4. Perform gentle range of motion exercises for extremities or encourage active exercises if able. 5. Educate the patient about signs of poor circulation, like numbness, tingling, and skin changes, and when to report them. These preventative measures aim to maintain good blood flow to Mrs. Carter's arms and legs. For risk for infection, spread or new. 1. Monitor vital signs, especially temperature, every 4 hours for signs of new or worsening infection. 2. Practice and promote strict hand hygiene for all staff, visitors, and the patient. 3. Assess character of sputum for changes in color, consistency, and amount, and report significant findings. 4. Ensure aseptic technique during all invasive procedures, such as IV care and medication administration. 5. Educate patient and family on infection prevention measures, such as covering coughs and proper hand washing. These interventions are designed to protect Mrs. Carter from acquiring additional infections while she is vulnerable. Section 7. Measuring progress. Defining nursing outcomes. Nursing outcomes are specific, measurable, achievable, relevant, and time-bound goals for your patient. They describe the desired state of the patient after your nursing interventions have been implemented. Outcomes should directly relate to your nursing diagnoses and help you evaluate the effectiveness of your care plan. For each diagnosis, you should identify outcomes that show the problem is resolving or being managed. For Mrs. Carter, we will define 5 key outcomes that correspond to her nursing diagnoses, providing clear targets for her recovery and care. These outcomes serve as benchmarks to track her progress and adjust the care plan as needed. For the diagnosis of ineffective airway clearance, appropriate outcomes would be: 1. Patient will demonstrate effective coughing and clear breath sounds on auscultation within 48 hours. 2. Patient will maintain a patent airway, evidenced by normal respiratory rate and depth by end of shift. 3. Patient will expectorate sputum effectively and report decreased congestion within 3 days. 4. Patient will verbalize understanding of techniques to clear secretions, such as deep breathing, coughing, and hydration, before discharge. 5. Patient will maintain oxygen saturation above 92% on room air or prescribed oxygen by the end of the week. These outcomes focus on tangible improvements in Mrs. Carter's ability to keep her airways clear. For impaired gas exchange, suitable outcomes include: 1. Patient's oxygen saturation will remain at or above 92% on prescribed oxygen therapy consistently for 24 hours. 2. Patient will report a decrease in shortness of breath and dyspnea during rest and minimal activity within 3 days. 3. Arterial blood gas values, if measured, will return to or approach patient's baseline levels within 72 hours. 4. Patient will exhibit no signs of increasing respiratory distress, such as restlessness, cyanosis, or use of accessory muscles throughout hospitalization. 5. Patient will be able to tolerate gradual weaning from supplemental oxygen as condition improves prior to discharge. These outcomes indicate that Mrs. Carter's lungs are effectively exchanging oxygen and carbon dioxide. For activity intolerance, targeted outcomes are: 1. Patient will report a decreased level of fatigue and participate in self-care activities with minimal assistance within 3 to 5 days. 2. Patient's vital signs, like heart rate and respiratory rate, will remain within acceptable limits during and after activity within 1 week. 3. Patient will be able to ambulate a specified distance, for example, 50 feet, with assistance 2 times a day within 5 days. 4. Patient will verbalize understanding and use of energy conservation techniques by day 3 of instruction. 5. Patient will demonstrate increased tolerance to activity as evidenced by performing activities of daily living with less shortness of breath by discharge. These outcomes show that Mrs. Carter is regaining her strength and ability to perform daily tasks. For risk for ineffective peripheral tissue perfusion, preventative outcomes would be: 1. Patient will maintain palpable peripheral pulses and capillary refill less than 3 seconds in all extremities throughout hospitalization. 2. Patient's skin on extremities will remain warm, dry, and intact, with no signs of breakdown or discoloration during hospital stay. 3. Patient will verbalize understanding of measures to promote circulation, such as leg exercises and avoiding restrictive clothing within 48 hours. 4. Patient will not experience any numbness, tingling, or pain indicative of impaired perfusion in extremities. 5. Patient will actively participate in position changes and leg exercises as instructed by nursing staff daily. These outcomes confirm that good circulation is being maintained in Mrs. Carter's limbs. For risk for infection, spread or new, key outcomes are: 1. Patient will remain afebrile, with a temperature below 38 degrees Celsius or 100.4 degrees Fahrenheit for the duration of antibiotic therapy. 2. Patient's white blood cell count will trend towards normal range within 5 to 7 days. 3. Patient will demonstrate no new signs or symptoms of infection, such as increased cough, changes in sputum, or new pain during hospitalization. 4. Patient and family will verbalize understanding of infection prevention techniques like hand hygiene and cough etiquette before discharge. 5. Sputum cultures, if repeated, will show decreased bacterial load or pathogen eradication by end of treatment. These outcomes indicate that Mrs. Carter is free from new infections and her current infection is resolving. Section 8. Medication management scheduled and PRN medications. Understanding a patient's medications is a critical part of nursing care and care planning. Scheduled medications are those given at regular times each day. It is important to know why the patient is taking each medication, its indication. For Mrs. Carter, her scheduled medications will likely include antibiotics for her pneumonia, medications for her COPD, and medications for her type 2 diabetes. Knowing these helps you understand her overall treatment plan and monitor for potential side effects or interactions. This knowledge also aids in patient education, as patients often have questions about what they are taking and why. Here is a list of possible current scheduled medications for Mrs. Emily Carter, along with their indications. 1. Levofloxacin, 750 mg IV daily. Indication antibiotic for treatment of community-acquired pneumonia. This medication works by stopping the growth of bacteria causing the infection in her lungs. 2. Fluticasone salmeterol inhaler, for example. Advair Diskus, 1 puff twice daily. Indication combination corticosteroid and long-acting beta agonist for maintenance treatment of COPD. It helps reduce inflammation and keep airways open. 3. Metformin 500 mg orally twice daily. Indication oral anti-hyperglycemic agent for management of type 2 diabetes. It helps lower blood glucose levels by improving insulin sensitivity and reducing glucose production by the liver. 4. Atorvastatin, 20 mg orally once daily at bedtime. Indication statin medication to lower cholesterol levels. Often prescribed for patients with diabetes to reduce cardiovascular risk. 5. Acetylcysteine, Mucomyst, 600 mg nebulizer treatment 3 times daily. Indication mucolytic agent to help thin and loosen mucus in the airways, making it easier to cough up. This is particularly helpful with her pneumonia and COPD. These medications address her acute infection and manage her chronic conditions effectively. PRN medications are given as needed for specific symptoms. It is important to document when PRN medications are given and assess their effectiveness. For Mrs. Carter, PRN medications might be for pain, fever, anxiety, or breakthrough shortness of breath. Knowing which PRN medications have been recently administered can give you valuable insight into the patient's current comfort level and symptom control. For instance, frequent use of PRN pain medication might indicate that her pain is not well managed with scheduled doses, or that a new issue is arising that needs further investigation and assessment. Here are some PRN medications that Mrs. Carter might have received within the last 2 days. 1. Albuterol inhaler, for example, ProAir HFA, 2 puffs every 4 to 6 hours as needed for shortness of breath or wheezing, given yesterday afternoon and this morning due to increased wheezing. Indication short-acting beta agonist bronchodilator for relief of acute bronchospasm. 2. Acetaminophen, Tylenol, 650 mg orally every 6 hours as needed for fever above 38.5 degrees Celsius or mild pain, given last night for a temperature of 38.8 degrees Celsius. Indication analgesic and antipyretic for pain relief and fever reduction. 3. Lorazepam 0.5 mg orally every 8 hours as needed for anxiety, given once yesterday evening when she reported feeling very anxious about her breathing. Indication benzodiazepine for management of anxiety. 4. Ondansetron, Zofran, 4 mg IV every 6 hours as needed for nausea or vomiting, not given in the last 2 days but available. Indication antiemetic to prevent or treat nausea and vomiting. 5. Guaifenesin 200 mg per 10 ml oral solution, 10 ml every 4 hours as needed for cough or chest congestion, given twice yesterday to help with mucus expectoration. Indication expectorant to help loosen phlegm and thin bronchial secretions. Careful tracking of PRN medication use is essential for evaluating the overall care plan success. Section 9. Conclusion: the long-term benefits of Mastering Concept MAP Care Plans. Mastering Concept MAP Care Plans offers significant long-term benefits for nursing students as they transition into professional practice. These tools are not just academic exercises. They are fundamental to developing the critical thinking and clinical reasoning skills essential for safe and effective nursing. By learning to visually connect patient data, pathophysiology, nursing diagnoses, interventions, and outcomes, students build a holistic understanding of patient care. This comprehensive approach allows them to see the bigger picture, anticipate patient needs more accurately, and make well-informed decisions in complex clinical situations, which is a hallmark of an expert nurse. The ability to create thorough and logical concept map care plans translates directly into improved patient outcomes. When nurses can clearly identify priorities, implement targeted interventions, and evaluate their effectiveness, patients receive more personalized and efficient care. This structured way of thinking helps new nurses organize their workload, manage time effectively, and communicate more clearly with other healthcare team members. The skills honed through concept mapping, such as problem identification, prioritization, and evidence-based practice, become ingrained habits. These habits contribute to a higher standard of care and increased patient safety across all healthcare settings. Furthermore, proficiency in concept mapping enhances a nurse's confidence and competence. New graduates who are comfortable with this process often feel better prepared to handle the challenges of real-world nursing. They are more adept at adapting care plans as a patient's condition changes and are more skilled in collaborating with interdisciplinary teams. This confidence is crucial for professional growth and job satisfaction. Employers also value nurses who demonstrate strong analytical and organizational skills, which are directly cultivated through the regular use and mastery of concept map care plans during their educational preparation for the demanding field of nursing. In conclusion, the effort invested in mastering concept map care plans during nursing school pays substantial dividends throughout a nursing career. These maps foster a deep, interconnected understanding of patient care, promote critical thinking, and improve communication. They equip future nurses with the essential tools to deliver high-quality, patient-centered care. Therefore, students should embrace concept mapping not as a chore, but as a powerful learning strategy that will shape them into competent, confident, and compassionate nursing professionals. The skills learned will serve them well, enabling them to navigate the complexities of healthcare and make a meaningful difference in the lives of their patients every single day.